Living with a medical condition can have an impact on your mental health and well-being, but that shouldn't be the case. Breathe Arts Health Research has created innovative healthcare programmes engaging people through creativity and science, helping people to lead healthier lives. I'm joined now by Richard McDougall from the Breathe Arts Health Research team, and he's here to tell me more about it. So tell me a bit more about what you actually do.
Well,
it sounds very intriguing.
Oh, thank you. Breathe Arts Health Research it's a not-for-profit social enterprise, and we use the arts creatively in healthcare. So we have a range of programmes. We have put on 1,400 music events to change the environment in the hospitals, so that benefits patients, doctors, visitors and staff. We put on a programme called Melodies for Mums, which is now helping mothers with postnatal depression. And these are scientifically underpinned to show the efficiency of these programmes. But the programme that I've been most closely associated with is Breathe Magic, which helps one particular patient group, but using magic as the creative tool to reach them.
So tell me a bit more about that then.
So we work with a particular group of young people between 7 and 19 in their age groups, boys and girls, with a condition called hemiplegia, which is a brain injury which has affected one half of their body. So their hand and their upper arm on one side is going to be severely affected and maybe even paralysed. And we have a team of magicians, all of very high standard, all members of the inner magic circle, or the members of the magic circle, and we work with occupational therapists. So they tell us the movements that these young people should be practicing, and then we go away and we create or design magic tricks that have embedded within them all the movements they should be practicing. So it's almost therapy by stealth, because they're having a lot of fun at the same time.
You've got a magic trick that you're going to show us, haven't you? Just by magic, you've got something.
So I thought I'd show you
how it actually works in practice.
How it works in practice. I can't explain how it works, obviously, because that would be giving the game away. But I thought what I would do is show you one of the pieces of magic that we teach the young children. It takes them a long time to learn it, but they put the practice in because they want to learn it. So this is the mystery of the jumping ball. And it takes place on a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and the two balls have changed. You're not buying it.
No.
Don't worry, it's all right. I'm not selling it. I'll do it one more time for you, and it only takes a count of 10. 1, 2, 3, 4, 5, 6, 7, 8.
My word.
9, 10. And that is a mystery of the jumping ball.
And as you said, what's fascinating watching you close up was the movements that you're doing and how that is very important in terms of the therapy.
And every movement is choreographed and coordinated. That's the beauty about this particular programme, is that we're working so closely with the healthcare professionals. That's where the art and science absolutely meet, because if breaking this down, every movement has a reason. At the beginning, I said, this was the mystery of the jumping ball. Well, already I have an arm extension. Now, for a young person who may have a weakness in this arm and finds it difficult putting a coat on, that, or a shirt on, that is a good exercise for them to do. This grip of holding the ball just at the fingertip and thumb is good for pinching grips. So for a child whose hand may be fully closed because of their condition of hemiplegia, them wanting to do this is one step closer to doing a button. So the next thing I said was it takes place on a count of 10. Well, now I've got you to open your hands, which again may be very, very challenging for them, but day by day, with close support from the occupational therapist, we can get them to that stage. And then you have wrist extension. You may need that to push open a door. This part, 1, 2, well, to put your hands flat, you may need that at school to hold a book to write on it. 3, 4, you need to be able to turn your hand over and open it flat, if you're at school, for example, to hold a school tray. If you don't want to be the last one at things because you're struggling every day, because everything is a real challenge, and this condition can lead to a lot of mental health issues and low self-esteem, by doing this, you're not only giving them a skill that their friends can't do, and this suddenly makes them a little bit special because they've got this wonderful craft that they can learn and practice, they're actually helping them with their daily living activities so they lead more independent lives.
It must be so satisfying for you personally to be able to share your magic, but actually change somebody's life in the way that you do. Can you give me an example of somebody who really, through this magic, has changed their life?
I see it every time, and it is truly astonishing. And I have to emphasise it is underpinned by science. But a boy of 8 whose hand has been closed all his life and is nervous at school assemblies and doesn't want to be on the school assembly, goes in to show his mother his hands open, and 6 months later was performing this magic trick at the Royal Festival Hall in front of 500 people. Or a girl of 19 at the other end of the scale who's never held a knife and fork before is cutting her food in 10 days and then going off to university. So it's not just for the individual child, the ripple effect for the parents, for the siblings. It's art in healthcare is massively, massively powerful.
Well, it's fantastic that you've been able to share your magic story with us. I know you're not going to tell me how to do the trick, but it's been great to meet you. Thank you so much. Thank you.